Good afternoon, everyone. Welcome to Harnessing Innovation to Rethink Your Ambulatory Care Environment. I'm Nicholas Bilas, the President for Healthcare Leaders in New York, and we are honored today to be co-hosting with the New York chapter of HIMSS. Even more so, I'm thrilled to have the New York HIMSS chapter president, Nick Cristiano, moderating today. Nick and I connected a few months ago as we realized there was tremendous value in collaborating, especially since our organizational missions so much aligned in that we are both unwaveringly passionate about the promotion of healthcare leadership, undoubtedly in a time when technology and innovation are both at their peak. The ability to come together in this way is truly amazing, laying a further foundation in creating an engaging environment for you all to share ideas, learn, and grow. I'm excited to see such an amazing turnout today of over 200 registered members listening live. I can tell you with confidence that the next couple of weeks and months are looking exciting. We're happy to announce HLNY is offering new digital content and webinars to engage with our members. We invite all those listening today, including HIMSS members, to take part of that. A special thank you also to Anthony Ferrante as well, the New York HIMSS president-elect, also on today, who will provide more detail about upcoming HIMSS activities and some of their innovative offerings later on. I leave you with one last remark, which is that I hope you all walk away intrinsically inspired this afternoon and beyond to take hold of your current situation, which to many of us feels daunting, I'm sure. But continue to push forward in innovation as there's no better time. In our discussion today, I foresee us quickly appreciating that technology for technology's sake is a mistake. Automating bad processes still results in bad processes, which is why strong leaders like yourself are needed to identify and solve problems early on. I'm looking forward to our moderator and panelists today sharing what they have fundamentally learned as they continue to innovate in the right direction. Let's get right into it, and I'll hand it over to our moderator, Nick Cristiano.
All right, thank you. So why don't we get started? So I want to thank everyone, and thank you, Nick, for making that introduction. We appreciate it. We have the ability to collaborate with fellow healthcare-oriented chapters. We have 3 panelists today. We're going to do something a little bit different than what is typical of these presentations. We're actually going to have an open debate. We're going to pose questions to our panelists and have them present their points of view. We're looking for interactive dialogue. We're looking for you to create questions through the chat session so we can address them as well. We're going to kick off with our 3 leaders giving a little introduction on themselves and their background. I'm Nick Cristiano. I'm the current president of the New York State chapter. I'm also the CEO of Aris Radiology, which is a teleradiology firm. Been in the business more years than I care to think, but healthcare is definitely a passion. So at this point, in the order of alphabetical order, we'll ask Mary Ellen, and then Stephen, and then Jen. Just give a quick background on yourself and your organization so the audience has a point of orientation as to where your thoughts could be coming from. So Mary Ellen, why don't we start with you?
Thank you, Nick. So happy to be here this afternoon. So by way of background, I'm a nurse for many, many years. I started off on the hospital side, went to hospital administration, worked on the hospital admin side, and had the great opportunity while I was there to be part of 3 people that formed Fidelis Care New York. So we created a managed care company in the city of New York way back in time. And we always said if we knew then what we know now, we probably wouldn't have done it, but we learned a lot. So I went on to have a very long career in managed care. Obviously, Fidelis was a great opportunity, taking it statewide, learning all the ins and outs, then moving on to places like GHI and Emblem Health. One of the most intriguing experiences of all was with Oscar Insurance, where I had the opportunity to start up as one of the people who helped stand that company up, but learn about tech from roles other than healthcare and how it could really support what we wanted to do. Along the way, I did a turn back to visiting nurse service of New York, went back to my roots as a nurse and provider side, and then most recently wound up at Village Care New York, where it was the great opportunity to work with a managed long-term care plan. I had the good fortune to retire at the end of 19, and since then, again, based on my interest in Oscar, I support a lot of healthcare tech companies that are emerging. So working with them on their business model, how to move forward. Obviously, these are groups that have gone well into the funding rounds and are doing really well. And there's such excitement on that horizon. So the point of view I want to bring to the conversation today is, even though I understand hospitals and ambulatory care, I understand the managed care payer side, I really want to talk about innovation on the health tech providers side, which is really inspiring. So thank you, Nick. Let me hand back to you.
All right. Thank you very much, Mary Ellen. All right. Jen, if you don't mind, could you introduce yourself?
Hi, everybody. I'm Jennifer Toda. I'm one of the senior directors at Memorial Sloan Kettering, overseeing our outpatient operations here. I've been with MSK for about 23 years, working in frontline operations, and then working my way up to a leadership role. I oversee day-to-day operations for many of our outpatient facilities, mainly in New York City. And much of my focus has been in opening our new facilities, deploying technology, as well as, in particular, outpatient practice and infusion operations. And I'm honored to be here, thrilled to be partnering with my colleagues, Mary Ellen and Stephen as well.
That's good.
Thank you, everybody.
Stephen Goriah here. I'm currently the Vice President of Information Technology in the Enterprise CIO for WMC Health in the Hudson Valley area. Have over 25 years of healthcare IT experience, so I'd love to share my perspective specifically relating to ambulatory care and everything we went through the COVID and how this is impacting the new normal. So I'm glad to be here.
Great. All right, we're going to get right into the questions. So the first question for the panel, and I'm going to open it up. Whoever feels the most passionate about the response can go first. 4 months ago, rethinking our ambulatory care environment might have meant something completely different than it did with the advent of COVID-19. Necessity may be the mother of invention, but COVID-19 became the architect of the new norm. How has the current crisis impacted the plans you had in place for the ambulatory environment?
Nick, this is Steve. I'll take that. With digital transformation, as we're looking at digital transformation across the continuum, as our patient needs are changing, as they're looking for lower cost, best quality, and highest level of convenience, the move to consumerism in healthcare has been growing tremendously. And I think the impact of COVID-19 just enhances that. As with everything in every organization that tries to go through change and advance and move into a digital world, the ability to change and drive change throughout the organization, it's a really hard thing to do. And as Harvard professor John Cotter said, if you don't have a burning platform, you create one. I think COVID-19 is our burning platform and an opportunity for us to really drive digital innovation to help the organization drive change in the way care is delivered to our organization. There are many, many things that can be done with technology, but I think technology, as a CIO, we need to partner with the operational leaders and clinical leaders to make sure that we're strategically approaching this, not in a reactionary mode. As we're coming out of COVID and there's so much pent-up demand for care that was put on hold, care that was elective and necessary that really was not done during the COVID crisis, there's a pent-up demand and we must be prepared and ready to go when everything is starting to open back up. As in the Hudson Valley here, things are starting to open back up and we're doing a great job of reacting to things and getting things back in place. But we must think strategically, how can we use this event to really transform care delivery to our patients?
I'd like to add to that. This is Mary Ellen. I think COVID changed the entire landscape for ambulatory care and what it could be. In the venture capital healthcare startup space, one of the companies I serve on the board for is Eden Health. They're an amazing company. So they really introduced the employer aspect into this. So not only was the primary physician in a relationship with their patient, but now the employer entered. because employees were now distributed across sometimes 3 states. Employees were calling the employer, when can we come back to work? Employers had a lot of questions about how can we come back to work. All the offices were closed. How do you manage that? And Eden, I think, in a brilliant move, leveraged all their virtual care capacity to reach out to employees across state lines and work with employers to make testing available. To actually, we talked about things like setting up our own drive-through at a local CVS, working with Quest and LabCorp, Quest in particular, on home testing. Employers didn't want the old nasopharyngeal testing. They wanted saliva testing because that's what their employees were telling them. How did we work with employers to look at under what conditions could those employees return to work? Were we doing mass temperature testing? There was a whole lot of interest by companies with 30,000 employees. On one weekend, we drop shipped 30,000 home testing kits to employees who couldn't get to their usual doctor. It changed the whole equation and connected the patient, the physician, and even the employer in very different ways. And I think the age of virtual is here to stay. Once these people got used to communicating through text, talking to their doctor via the phone, odd hours that really accommodated family situations, obviously e-prescription into the pharmacy without a doubt, but it's changing the landscape forever. And brick and mortar needs to really look at what are the virtual options and how much they're being adopted by patients in the age of COVID. How do you manage normal care when brick and mortar is not possible, and how much of this will last well into the next gen of AmCare?
I would add to what both Mary Ellen and Stephen have said that, in some avenues of healthcare, I think the brick and mortar, there has to still be a brick and mortar presence. For instance, procedures, some infusional therapies, etc. But I think, like Mary Ellen said, the age of tech is here to stay, and we need to be able to be nimble between tech in the brick and mortar and tech in the patient and the physician and the care provider's home. I will add, though, although COVID sort of forced us to get there, I think we could not have done it so swiftly as an industry if we didn't have some of the relaxing of the regulatory guidelines that we had been up against in the past. For instance, licensing across state lines, and let's say a New York physician having a televisit with a New Jersey patient couldn't happen so easily from a reimbursement perspective prior to COVID. And now we're seeing, that's one example of how the regulatory bodies have really worked with us in this crisis. And I think that was key to moving things along. Being such a regulated industry, I think that's one avenue that we really have to sort of stay connected to in terms of continuing to perpetuate the digital revolution, if you will, in healthcare.
Jennifer, I completely agree with you, Steve. But there's a push. I just saw a recent HIMSS survey that really said about they surveyed 200 digital health leaders across the enterprise, across the country, and people were more concerned about enhanced reimbursement for telehealth and all digital care and enhanced reimbursement for home health monitoring. I think it's critical for us to help the organizations like CHIME and others push the folks in Washington to make sure that the regulations keep adjusting, and we're in reimbursements and all the rules are changing as we're trying to change and be adaptive to our patients as well.
This is Mary Ellen. I couldn't agree more. Reimbursement has to absolutely lighten up. In a commercial insurance environment, an employer can pay for some of these things over and above a typical benefit package. But when you look at government programs, regulations have to come up to speed with what commercial employers can pay for. The other piece I think we need to look at for regulation, as Jennifer is 100% right, is medical records, sharing of information. So when COVID hit and people went to go to their normal doctor in their community and found the doctor's office was closed, they were calling into virtual care doctors, but without the benefit of the history. So looking at how to share medical records in an ambulatory environment across settings, I think is another thing we strongly have to look at. And how can we leverage a group in New York, we have Healthix. I think they're an amazing organization that would step up to work with us. But how do we begin to work? I know Healthix planned and did great work around Hurricane Sandy. This pandemic thing provides a great setting for us to figure out how do we apply the lessons learned from Sandy in a setting. So yes, a lot of regulatory reform needed to make this loosen up and work better.